At the end of life, there are countless feelings that the dying and their families experience. Worry, stress, and overwhelming grief are just a few. The last thing that the dying and their families would want is for this end-of-life time to drag on for months and be filled with dreadful emotions and pain. If the dying and their families would not want to suffer through this time, should they not have the right to make the decision to die? Simon Jenkins says in an article, "There cannot be a human freedom so personal as ordering the circumstances of one's own death. People should have the right to die with dignity rather than live a life of embarrassment, dependence, and pain." Those who make requests for assisted death have common fears including, but not limited to, dementia, blindness, paralysis, sickness, inability to swallow, vomiting, diarrhea, lesions, Alzheimer's, smelling, bed sores, disfigurement, loss of control, and loss of dignity. In the article, Joining a Right to Die Society by Cleve, Seal, Judd, and Marion, others may want to die not because they are in pain, but they feel they are too dependent on others, a financial burden, vulnerable, and hopeless. No one should have to fear what they will experience at the end of their life, and no one should have to ever endure these issues. Fate, or Friends at the End, is a right to die society in the UK that provides information, support, and advice to its self-joining members who want to have the right to end their life if they so choose in the future. A survey of all Fate members was conducted by Marion Judd and Clive Seal to gain more knowledge about people's motivations to join a Right to Die society. The survey revealed that 72% of people were extremely concerned about the loss of control. 64% of people were extremely concerned about their loss of dignity. 60% of people were extremely concerned about being a burden to others. And 61% of people were extremely concerned about being too dependent on others at the end of their life. One member stated, "When living becomes a burden to myself and others, I want to be able to end it with dignity and composure." Not only would the act of assisted suicide benefit the ill, legalizing physician-assisted death could change insurance for the better. Health insurers would actually be benefiting from assisted suicide patients. Health insurance would no longer have to pay for extensive medical care for those who are critically ill to keep the patients alive. According to Frederick Parker, Harvey Rubin, and William Winslade, health insurance should instead accommodate the patient and minimize pain and slow death. Life insurers should negotiate benefits with the insured before they ever become ill to determine an insurance plan that both suits the insured and the insurers. Another solution to life insurance would be to maximize the financial assistance when the family most needs it, not always necessarily after death. Oregon has legalized physician-assisted death, and it is easily seen that the citizens of Oregon have benefited. Ron Wyden explains in his article that Oregon is the first state to give its citizens the right to die. Parker, Rubin, and Winslade explain that in Oregon, doctors may prescribe lethal medications to patients who are a legal resident of Oregon, able to make and communicate healthcare decisions, have an illness that will lead to death in 6 months or less, makes 1 written and 2 verbal requests for the medication, and is informed of all alternatives. Since the passing of this law, families feel at peace and in control of their life. People are no longer worrying about suffering loved ones or about what they may do if they are ever suffering from a terminal illness. It is easy to see that having the right to die the positives far outweigh the negatives. Our nation should follow Oregon's lead to legalize the right to die, to allow our citizens the right to die with dignity. Legalizing euthanasia would give them freedom of death, give their families peace of mind, and make death a less painful time for everyone. People should have the right to die with dignity.